Hey there, and welcome back to another episode of the Sports Medicine Midwest podcast. I'm your host, Dr. Seth Myers, a sports chiropractor in Salina, Kansas, and I wanted to do a podcast about injuries, specifically management and rehab of general sports and soft tissue injuries. And so, again, like last time, I'm doing both video and audio of this, so if you're listening but you want to see the resource I'm going to mention, you can check that out on our YouTube page or Facebook. But this podcast episode specifically is going to be talking about updates in terms of managing different soft tissue injuries, again, specifically in the sports world. So if you've been around sports for any time now, you have probably heard of some different acronyms that people commonly say and use to help manage different injuries. So what I mean is things like ICE, ICE, and then RICE, RICE, and PRICE, and police. And if you're watching the video, I'll scroll down so you can see the different acronyms. And those stand for the things that you would do when someone gets hurt. So, for example, if someone were to roll their ankle, you would grab maybe some ice, you would compress it, you would elevate it. That's what ICE stands for, which, again, ICE graduated eventually to RICE and PRICE, and then eventually police. Well, there have been some updates on the specific acronym, and that's what I'm going to be talking about today. And so this article came out a little while ago, I say a couple years anyway, in the British Journal of Sports Medicine. So it was a very well-recognized journal, very well-respected, and it is a article suggesting we should upgrade again to a new acronym, or in this case, set of acronyms. So the one thing that this article mentions is those old acronyms, ICE, RICE, PRICE. They all focus on what you should do in the acute stage of an injury, meaning just shortly after it happens, what do we do? And it doesn't mention anything, or those acronyms don't say anything about what we should do in the subacute stage, or days to potentially weeks after the injury in terms of rehab and management. And so the new acronym that they came up with is two words. It's peace and love. And so the name of the article that I'm referencing here is Soft Tissue Injuries Simply Need Peace and Love. And so the peace, P-E-A-C-E, component is in reference to what we should do in the acute stage of injuries, and the love, L-O-V-E, part is in reference to what we should do in the subacute stage to rehabbing and managing injuries. So if you are a player, coach, physician, things of that nature, and you haven't heard of this, I would recommend checking out the article, and I'm going to go over what those letters mean here in just one second. So again, if you haven't heard of this, this is kind of the new set of acronyms that we should be using moving forward. So on the video, I'm changing screens so you can see what the letters, what words they stand for, and listening along here should be super straightforward. I'm going to go through each letter and talk about what they mean. So starting with P for peace. P stands for protect. So in the past, that's generally what we've seen with the other acronyms, so nothing really new there. The only thing I will point out is maybe the timeline. So in the new version for peace, the protect, it does mention just 1 to 3 days, depending on the severity of the injury. You can see that in the full text if you go read it. But basically, we want to try and protect the injury depending on what's happened, but with the mindset of we want to try and get to be as active as we can as soon as we can. So in the past, maybe we would have recommended being a bit more immobile for longer. In this case, we still want to protect it, but we want to have the intention of trying to get things moving quickly, and we'll talk about that here in a second. So moving on to E, again, there's nothing new here. This is elevation. So that's, again, been in some of the previous acronyms. So rolled ankle is a great example of this. If we roll our ankle, we want to try and prevent that joint from swelling. We can put ankle above our heart to, again, try and minimize fluid accumulation, things of that nature. So not much new there, so I won't spend too much time there. So moving on to A. So this is a new component of management for injuries. that we haven't seen in the past. A in this case stands for avoid anti-inflammatories. So this takes a little bit more explaining. And so if we have an injury, there is naturally going to be an inflammatory response. And so there's been a bunch of talk, both in injuries and in diets and whatever, about trying to avoid inflammation. The thing about that, though, is some inflammation, and especially as it relates to in our bodies, is actually a normal and in some cases good thing. So when we have this inflammatory response for, let's say, a sprained ankle, that inflammation is basically, you can kind of think of it in your brain as putting down little flag markers, right? And telling your body or signaling to your body, hey, we need some help here. We need to rebuild. We need to kind of come back in and fix this tissue, right? Well, that should happen normally and does happen normally on its own. But if we artificially take in these anti-inflammatories, such as just NSAIDs or over-the-counter medication, what we could be doing is dampening that inflammatory signal so our body doesn't respond to it as it normally would. And so if that happens, what might happen, big picture, is injury doesn't resolve or get as patched up as it would have been had we not taken any anti-inflammatories. That also, same can be said for ice. And so if you're watching the video, you can see in the little description below it, it also says avoid icing. So that's kind of the same thing. So generally speaking, ice is going to slow things down, prevent maybe some blood flow, things of that nature. When, again, the blood flow is going to be what's bringing in new nutrients, helping clean up some of that inflammatory response, so on and so forth. So if we ice, in theory, what we might be doing is slowing down or shunting how quickly our body naturally responds to this injury, which might not necessarily be a good thing long term. The caveat and kind of nuance to this, which I would definitely recommend working with some sort of healthcare provider if you have an injury, is pain. So if you can go through the injury and rehab process without needing any anti-inflammatories because pain isn't super crazy, it's tolerable, that's ideal. There obviously are tons of instances where pain is maybe just too much to manage, and so you need some of the anti-inflammatories. Maybe you do want to ice to help numb up that area, and that's totally acceptable. The big thing here is if we can go without necessarily using those things, you're probably going to have a better overall long-term response and rehab for this specific injury. So again, that was one of the biggest new pieces of info that we've seen, and so I wanted to explain that a little bit more. So if you've got any other questions about that, feel free to reach out to me by any means, but I'm going to move along here. So the next letter in piece is C, standing for compression. So again, that's nothing really new. Again, if we have a rolled ankle, we want to try and minimize some of that joint swelling. We can try and compress it with a wrap or some taping. And that's pretty much what we've seen in the past. So moving on to the last one. Again, this is a new component to the piece, or the new acronym here is education. So E standing for education. And again, I'll talk about this in a little bit, but what we know from the research is if we educate folks on their injuries, the rehab process, the timeline, the prognosis, all those things, what we tend to see is patients, number one, will have a better, more optimistic outlook on their injury and subsequently get through the rehab process either quicker or better than had they not been educated. And then the second thing is, which you can see if you're watching the video in the text description below, is then patients will likely not go out and seek unnecessary care. So sometimes in these in injuries, sports injuries, or soft tissue injuries, time is a very good friend of ours, and just kind of trusting the rehab process. When we don't know that, we haven't been told that, sometimes people will go out and seek other medical advice, other medical care, which doesn't necessarily get them quicker or better results. They end up spending just more time and money seeking those things. So again, you can kind of see that in the text description below, but if we educate them on what's going on, that can help have a better optimistic outlook on the overall injury and rehab process and save them money from unnecessary treatments that they might have otherwise sought out. So again, peace is making up what we would do in the acute setting of an injury, so when it just newly happens. And then the love, which I'll explain in just a second, this is the principles for which we would use moving forward in the subacute stage. So pain has kind of calmed down, maybe some joint swelling has calmed down, we're able to move around with minimal discomfort, and we want to start rehabbing this thing. What do? So L in love, standing for load. And so with getting back into moving around, we want to start loading up tissue. So we want to start getting some tissue to adapt and get stronger and more resilient. And again, the best way to do that is just start to load it up. And that's where we would probably want to get with a rehab provider professional to make sure that we're loading it appropriately, because sometimes just because some is good doesn't always mean more is better, right? We want to load it up, but if you don't know your limits there, we might just be spinning our wheels and not getting anywhere. So we want to start loading it up. Number 2 is optimism. So very similar to what I said with education. If working with a rehab professional, working with some sort of a provider or trainer, we want to keep the patient or player or whoever on a good outlook for their rehab process as a whole. If we can get them in the mindset that it's going to be okay, we're going to make it through it, we're going to be bigger, stronger, more resilient, able to get back to our activities at 100%, the likelihood that they're going to stick to the rehab plan, kind of stick through everything, even with the ups and downs of rehab, the likelihood that they're going to get out is much, much better than if we have a not so optimistic, obviously pessimistic view of our rehab process. So it's just one of those little things where it's not necessarily what the rehab plan looks like in terms of sets, reps, exercises, but making sure that on a psychological aspect they are in a good spot, taken care of, things of that nature, which can be tough, but very, very important to make sure that we're implementing as a rehab plan. Moving on to the next part, so V in love stands for vascularization. Very similar to what we've said before. One of the things we want to do is just generally bring in some new blood, bring in some good new nutrients, take away some of the old stuff. And a great way to do that is just generally getting blood flowing. So as part of the rehab process, maybe we're spending some time on a bike, on a rower, running, jogging, things of that nature, just something to get the blood flowing. That one should be pretty straightforward, but definitely want to make sure that it's included in the plan. And then the last part for love, which kind of similar to what we've already said, is exercise. That is kind of an all-encompassing term, though. So, for example, we don't necessarily just need exercise in the sense of getting stronger, right? We also need exercise that is going to be inclusive of joint mobility, right? So if we roll our ankle and that joint gets stiff, our ankle doesn't move like it used to, we want to include some mobility exercises. We also want to include in this, if you're watching the video, you can see it says the word proprioception, which is kind of sort of like balance, not exactly, but for what we're talking about here, we'll call it balance. So some coordination drills, right? Things of that nature. So it says the word exercise, but we want to be all-inclusive of mobility, strength, balance, coordination, things of that nature. And so that love, L-O-V-E, load, optimism, vascularization, and exercise is going to make up kind of the subacute and rehab phase of an injury in terms of principles that we're going to use and implement moving forward. So if this is new to you, you haven't heard this acronym before, especially if you are a player, coach, sports medicine physician especially, I would encourage you to go look at the full text, which if you're watching the video, this is it right here. It kind of talks about those topics a little bit more in depth and lists some other studies and references that they pull that from. And if you are a coach, player, or provider, I would encourage you to use these as your principles for treating those things. Anyway, so I haven't seen this implemented a ton, like on the ground with different players and coaches I've heard from or talked to. So I just wanted to make a little podcast about this to talk about it. If you got any questions about this, by any means, you can always reach out. And I hope that this was very helpful. Thanks for listening.